Hello, my name is Donna Hall. I'm really sorry I can't be with you today in person, but I'm really pleased that you're interested in the background and the creation of the Wigan deal and the lessons learned. So you will see in a moment a short film that was made around 4 or 5 years ago now with Sir Chris Ham, who you heard from yesterday when he was at the King's Fund, and myself. So he interviewed me to really get beneath the skin of how the deal was created, what were the essential ingredients to make it a success. And really what was the kind of overriding philosophy behind our approach to doing it. So the two things that I think really stand out from the King's Fund report around the deal is, first of all, the clarity of purpose that made it different to other projects and initiatives to address health and well-being in an area. So it was we were really clear and simple that our role was to enable the creation of wellness in local communities, in local neighbourhoods, and that was our kind of core function. And then, so that's real clarity of purpose. And then secondly, they said, the King's Fund, that it was constancy of purpose. So the deal became our overarching strategy for everything, whether it was around economic development and business growth, whether it was about the environment, whether it was around health and wellness, housing, anything at all connected to the local area was beneath this overarching framework of a new social contract between citizen and state. I think very often patients, people are seen as passive recipients of services rather than active players in local communities who can really shape the health and wellness of a community. And that was the principle behind the deal. The single biggest thing that I think I'm most proud of, and citizens and partners in the NHS and in local government, in housing, in departments of work and pensions, in the police, everyone who worked together in Wigan as part of the team, is around the reduction in poor health, and in particular an increase in healthy life expectancy, so years of good health. And in the most deprived wards in Wigan, we managed to increase that by 7 years during the lifetime of the deal, which was a great achievement. We invested lots of money, around 13 million altogether, in the community and voluntary sector, in prevention activity, not commissioned in a traditional ivory tower way, but very, very much kind of grassroots, local ideas that came forward from the local community, and we believed in them, we invested in them, and we created 500 new projects together that were to tackle obesity, to promote good health, good mental health, physical health. They were there to tackle social isolation and loneliness, and they were for all age groups, healthy eating, all sorts of different things that you can read about if you read the King's Fund evaluation of the Wigan deal. The King's Fund came to stay with us and really spoke to residents, to staff, to partners. So it wasn't just an academic piece of research from a distance, it was an anthropological piece, and we really put anthropology at the heart of the Wigan deal. It wasn't about me, it wasn't about the ego of a leader or a political or managerial person in the NHS or in local government. It was about a place, and that's why it's still going on today. And very often strategies are short term. It depends who's in charge of the integrated care system, what their particular viewpoint is, you know, what the politicians think, and it shouldn't be like that. It should be shaped by the people, for the people. And that was why it was a deal. It was a partnership. My background's strategy and policy, and I've written hundreds of them. This is the only one that's actually worked, because it's about the place and it's about the people and it's by the people. So I hope you enjoy the film, and good luck with everything that you're trying to work on at the moment. Cheers. Bye-bye.
So Donna, perhaps you could start by telling me the story of the journey that Wigan has been on.
Okay, Chris, it's a long story and it's been going on for about 7 years altogether, and we're not finished, so that's, I think, the first thing to say, and we're quite humble about the progress that we've made. We're really excited though to share some of the great work that we've done. So the background to the Wigan deal was back in 2010. We were told by the Institute of Fiscal Studies that Wigan was the third worst affected place by austerity, with all of the cuts that were about to descend upon us. So 160 million altogether has come out of our budgets as a local authority. And so we realised at that time that we needed to do something radically different and kind of reinvent our relationship with residents, with citizens, not just the council but the whole of the public sector, the NHS, the police, DWP, everybody within that locality, within Wigan. We're the 9th largest metropolitan borough in the whole of the UK, so quite a substantial population and part of Greater Manchester.
Can you say a bit more about the Wigan deal and how that works in your programme?
So the Wigan deal is, in its essence, is very, very simple. We've managed to freeze council tax as part of it, so that's one element of our part of the deal, because people pay a lot of money as part of their council tax. People work really hard to pay that money. It's the largest proportion of tax that a lot of our lower paid residents actually pay. So making sure that we keep to our part of the deal and freeze it, as we have done over the last 5 years, and that's been really important to my politicians, to make sure that we keep to that part of the deal. And I think it's looking likely that politicians will freeze it next year as well, despite all the pressures that there are in local government. The residents' part of the deal is very much around behaviours, so it's about recycling, it's about looking after your neighbours, keeping fit and well. And it's something that I think the King's Fund have said should be applied really to the NHS in the new 10-year plan, that it's very much a partnership with between citizen and state, rather than everything being able to be fixed at with no limit on the cost. We need to explain to residents that costs are finite, and you need to help us and work with us to make sure we spend money where it should be spent.
And what are the results of this transformation programme? Are you really bringing about some benefits for your residents?
Okay, well, the first thing is it's managed to take out a lot of money from our system. So it sounds quite fluffy when you describe it in kind of anthropological, social terms, but there is an economic dimension to it as well. So far we've saved around 130 million, still about another 30 million to go. But ironically, our outcomes have improved over that time as well. So we've got one of the best performing hospital systems in the whole of the UK at the moment, with one of the lowest levels of delayed transfers of care, something like, I think we're number 5 in the whole of the country. We've got balanced budgets for both adults and children's, which is unheard of really in local government at the moment. We've got waiting lists of social workers wanting to come and work with us, because we give our staff the permission to innovate on the front line. We've got reducing numbers of children looked after. We're the happiest place in Greater Manchester, and that for me is really important. We measure happiness as well as health and well-being. We've got 14,500 children doing the daily mile in our primary schools and secondary schools now, and the parents joining in as well. So I think we've got as well a 7-year improvement in healthy life expectancy between where we were and where we are now. So over that 5-year period, despite the fact we've had no money, we've actually managed to improve healthy life expectancy massively within our population, within our more deprived communities, by working differently.
I know from what you've said that there have been some hard decisions about cutting back on services. So say a bit more about how you've done that and the alternative services you put in place.
We have, and the way that we've saved all the money is by stopping the things that don't work, and they tend to be things like expensive day centres where people are sat in the same room with people they don't know. You know, maybe we'll put on a little bit of activity for them, but they don't know the person, the people that they're sat with. So we've stopped doing things like that, and we've got much better outcomes by connecting people into local groups. So whether it's a language group, a French group, or a knitting group or something like that. We've got a fantastic partnership with our sporting clubs. So Wigan Warriors have a rugby memories group for people with or without dementia, where people can listen and talk and tell their own stories about the games and things that they've seen in the past on all their favourite rugby players. And it brings people to life really, rather than being sat in a municipal expensive solution. We've seen packages of care come down from £2,000 a week to nothing.
You've mentioned that you've trained staff in the council to go out and have different conversations with residents. What does that really mean?
Well, basically we have something called the Be Wigan experience, which every member of staff, whether you work in the police, whether you're a GP, whether you work in the hospital or you work emptying the bins for the council, you go on the Be Wigan experience. So it's a place-based organisational development tool, and basically we get people to challenge their own thinking about how they view residents, how they view communities, and try to really rebuild that relationship back up with our public servants working in that place, to try not to judge them, but to try to help them, to support them to be the best that they can be. So everyone's been on that. The board of the hospital, the consultants in the hospital, all the elected members are really heavily bought into it. And it's taken us 8 years to get here, Chris, so it's not an easy fix. It's a long process to get there, building trust between organisations, but it really does work.
Let's move on now to talk about the role of NHS colleagues and the contribution they've made to the improvements you've been describing.
The NHS has been really pivotal, I think, in driving it forward to this next more mature stage. So the two largest sources of expenditure in Wigan are the Council and the NHS. And we spend a lot of money on processes and systems that are not effective, or we used to do. Now we've started to really strip that back and think about the Wigan pound. How do we get better value for that? So that's the Department of Work and Pensions, the NHS, and the Council working in the place, wrapping services around residents. But it really has made a phenomenal difference to our residents. The NHS, I think, have been probably one of the most passionate advocates of it, along with the community and voluntary sector. They have been they've embraced this, and they've loved the trust that we've given them and shown that we can just, we trust them as equal partners, that we're not going to spend £100 monitoring a grant of £25 as we used to do in the olden days. We will give them the trust and the autonomy to go out and spend that money to help us take demand out of the system.
It's remarkable listening to you, what you've achieved. The surprise to me is that more councils haven't followed your lead and tried to do the same. Why do you think that is?
I think there's a little bit of a not invented here philosophy sometimes, where people think if we didn't think of this, then we can't apply it. We've got to create our own different way of doing things. Our model isn't a model basically that is unique to Wigan. We've kind of begged, stole and borrowed little bits of it and pulled it together from the Nesta work, from Hilary Cottam's work, from the fact we've got no money, so we had no choice really. We had to create something different. But the passion has really come from the community, from the way it's been embraced by our residents. So 82% of residents support the principles of the Wigan deal, which is absolutely phenomenal. When we got that figure through, I said to Maury, can you just check that again? Because I don't think that's right. That seems too good to be true, but it is true. And people really understand that we can't do things in the way that we used to do, in the kind of paternalistic top-down way that Wigan Council used to operate. We need a much more modern, a much more listening, much more intuitive and in-touch model for public services. Andy Burnham, our mayor in Greater Manchester, has kind of taken the principles of the Wigan deal and is now creating a new model for public services in Greater Manchester built on the basis of the Wigan deal.
Let me ask you about what it's meant for you as the Council's Chief Exec, as a leader. Have you had to change during the work?
It's been the most exciting period of my working life. I'm due to retire in February as well coming up, but it's been an absolutely brilliant 8 years. I think it's really how services should be designed around people, around communities, around what people enjoy doing. No one wants to be seen as a unit of need to be fixed by the state. That's not why public servants come into the jobs that they go into as well. So I think the elements of leadership to make this work are having a whole system, big picture vision for where you want to be, and that's what the deal is really. If
you look back, what's been the biggest mistake you've made during this journey?
I've made many. I think we should have gone for the kind of rollout of the whole approach with the NHS sooner, Chris, being honest. We stumbled around for a couple of years, and I think it was more we were all a bit nervously dancing around our collective organisational handbags and not really grasping it, and a lot of places do that, don't they? But I think we've got to go forward with boldness, with courage, because if we don't, we're letting our residents down. I wish we'd done it 2 years sooner than we actually did.
Donna, thank you very much for coming down and talking about what Wigan has been doing. It's a fascinating story, and I'm sure lots of people will be interested to hear about it. Thank you.